Good afternoon. This is Scott McGann, Falmouth's health agent, and today is April 10th. So I think this is the fourth installment, and we'll do this every week, and to try to give residents an up-to-date. Some of the stuff I'm going to talk about today will be repetitive from last week. Haven't really changed much other than, I'm going to be emphasizing the need to stay the course. As of today, we have 92 positive tests. Again, this doesn't include any asymptomatic or mildly ill people that may have not have been tested, but the number is 92. That represents about 2.9 people per 1,000, okay? State average is 2.7 per 1,000, and the Cape average is 2.1 per 1,000. So we're a bit higher than the average, okay? 440 positives in Barnstable County with 12 deaths. Falmouth is about 20.7% of all Cape cases, when our population averages somewhere around 15% of the Cape. So we're a little bit higher. We actually started higher, and that's why we're maintaining it. We're not growing it, I think, necessarily any faster than the other towns are right now, but we had for whatever reason, we had a sort of a kickstart. And again, our nurses at the VNA, myself, we're doing all the contact tracing to each case. Taking those that are, letting those know that they are active cases and need to be isolated, and also quarantining close contacts and researching who that is. Of course, if you're contacted, the information that we get from you is the best information we can get. So the lack of information, we're not going to be able to know what we don't know. So if you are contacted, either to be isolated if you're a case, or isolation in terms of a case, or quarantined because you're a close contact, be as open to who you have contact with as possible. In addition, follow the rules provided to you about isolation and quarantine. The last thing we need to do is have somebody who's isolated out about in town. We don't want that. You are most likely to spread it when you're sick. So the more symptoms you have, that's when you're at your highest risk. Yes, there has been some spread earlier, up to 2 days early before the show of symptoms. The reason why when you're quarantined, you don't go anywhere. And also, asymptomatic people. But for the most part, you're definitely going to be most likely, if you're coughing, to be spreading it. So we don't need you to be out. Okay. So again, if you get isolated or quarantined, please follow that and take that very seriously. It could mean, some very, very, quite a bit of people becoming ill from it. Could even be a death related to it. So please take it seriously. Like I said, there was 12 deaths on the Cape so far. The peak of the state they determined to be somewhere between the 10th and the 20th of this month. Okay, so we're not quite at what the state would consider to be the peak. And the state had originally estimated there'd be somewhere between 42 and 170,000 cases, 142,000 to 72,000 cases. That would put Falmouth in the 200 plus range. And so that sounds like very alarming numbers. I can tell you what, if we were not social distancing, I think that number would be at least tenfold. This coronavirus has a tendency to spread very easily through the population. And so the social distancing is definitely working. Again, on our website is www.falmouthmass.us. You can get your information from there. The email is health@falmouthma.gov. And our phone number is 508-495-7485. That's especially, again, 508-495-7485. And that's going to help people that may not be on the computer or have internet access. There might be a delay in getting back to you. There is a lot of volume, and there's only so many people that can return the calls. We do our best to get back to you. There's info on the website on how to get tested. If you feel you need to be attached, you would contact your physician. They would they would schedule that with the county, Barnstable County, who does it, and Barnstable County would schedule it with you, and you would go to 4Cs, Cape Cod Community College, and be tested. Don't call the health department if you're sick. You want to call your doctor. You want to do this through your physician, okay? Yesterday, we sent out I guess you'd call it a reverse 911 or a code red robocall. We also did it in conjunction with the school departments and the senior center. It's not a change. This wasn't a change in policy. This is just an emphasis. Basically, what I said is the message is being sent on behalf of health agent me. We're reaching out to all members of the community to ask help in slowing the spread. We expect to see an increase, and we don't want you to go out any more than necessary, only to take care of essentials. Practice good social distancing, good personal hygiene, don't panic, but take it seriously, and we're all going to benefit. And that's kind of in a nutshell what I had said. It's common sense, and I apologize if I'm being repetitive, but it is what we're trying to get out there. I can guarantee you that the better job we do at social distancing now will shorten the time frame at which we need to be under this mandate of being of social distancing. How we're going to get out of this is going to be when the scientists, the epidemiologists who study the disease, determine it through science and through the mathematics of it. And so it's very important that we all sort of do our part. I know most of us are, and you that are reading it are probably as well. In terms of going out, we're looking at, if you can keep it down to, once a week max to go to get what you need. We're trying to avoid the boredom shopping or the shopping just to, get out of the house. The more times you go to a place, the more contact you have with people, the more your risk is. So try to keep your shopping to a minimum, especially over the next couple of weeks when the peak is expected. Masks have also been an discussion item. People have asked questions about masks. We are asking if you have them to be worn in public. It really helps the people it helps protect others from the fact that you may be asymptomatic. Masks work better up against the mouth of the individual who may be spreading this disease unknowingly. So we have been asking people to wear masks out in public because of the high rate of asymptomatic people. And masks work much better, I think I've mentioned this last week, on the person who happens to be ill. I've also been asked about animal spread, and there's no evidence that a pet would transmit it to humans. There was a couple cases, I think a case last week in New York at the zoo, of tigers and lions receiving it from a human who had it, and I've also heard that ferrets can also contract it. It hasn't shown that it's gone the other direction from the animals, from the pets to from your pet to a human. There could be perhaps some shedding of the organism if you were somebody who had COVID-19 and pet the dog, and then the dog immediately ran upstairs and went to somebody who had not, then I guess there's a possibility on the fur. But, there's someone had asked that question and asked me to bring it up today, which I am. And that's the best information that I have on it. The Friends of Falmouth Dogs put out a brochure as well, if you can get that. I don't know exactly how you get it, basically outlining the same thing. So again, just to repeat, and to go back to what I was saying about the 92 cases, not everybody's, in the hospital with it. Not everybody is. Some are, some aren't. There are some of those people of the 92 are out of isolation and are fine now. So that happens, and that's going to happen for the vast majority of us. It does sometimes take a while. There's a lag. It takes a while to be, symptom-free for 72 hours after this, and so it takes a while to get out of isolation. But there are some. I don't know the exact number off the top of my head, but there's some that are out. And there are also some that are suffering from this, and it's unfortunate. As far as data, people have been asking me a lot about providing more information on the case count. I think I mentioned this before, but the Department of Public Health has asked that we follow just using their website and the count by numbers by county. We're continuing to post by number of cases. No more information than that. We're actually doing beyond what DPH would want us to do. The information by county is valuable, and you can get that every day around 4 o'clock. If you go to the State Department of Public Health's website around 4 or 5 o'clock, they'll update with today's numbers, and they'll give you the county numbers. And I've given you the numbers of Falmouth residents, and you can simply do the same math that I did. We're not going to go any beyond like age and things of that nature, and we've had some requests about more details on whether that person happened to be at a certain place at a certain time, and we're not going to do that. We're just going to post the numbers. Again, just keep staying the course. Just to recap, we're expecting the peak this week, next week around there. The better we do it social distancing, the quicker I think we can get out of this, at least at some point out of this. I don't know what the end game is. I do get a lot of people calling about the, when are we going to be this, or when are we going to be back to normal? I do not know that answer. I don't think anyone really truly knows exactly when and what it's going to morph into. But I think we just need to do our best to not work when we're sick, not come to work, not go out. If we have any symptoms, get ourselves tested. The tests are readily available. If you feel symptoms of fever, cough, especially that dry cough, any respiratory issues, easy to get a test. At the test site, where they're doing the testing at 4Cs, they're coming out with about a 20% positive rate. So if people that are going there have symptoms, only 1 in 5 are coming back with COVID. So there are other things, so it might be something else. But do not go out if you have any symptoms. Go get tested. And while you're waiting for your test, you should be isolated. So it's best to assume that you have the disease and isolate yourself. Don't continue shopping thinking, well, it was probably one of the 4 out of 5 that wasn't. So let's make sure that you keep yourself away from people as much as possible. Do not go any public places until your test results come. The results do take several days. They generally will get back to the positive people quicker, but they are done in large batches on the labs, and so it does take a little bit of time to get your results. But you should treat yourself as potential positive in that, because you do have symptoms, because that's why you got tested. And since we've been tested, we should be waiting to those results at home, isolated as much as humanly possible. And that's all I have for today. Thank you.